Some people do, but a lot of times, many people don't have the support that they need where they can say, um, in my case, I had my sister as my proxy where I could say, Michelle or Georgette, can you just handle these forms? I can't, I'm not up to it right now. And they
Mm.
have to be in because they give you a really quick turnaround and they have to be in within the next 2 to 3 days. So can you just complete all pages 1 through 10 and send them back? When it can actually be a one page. It could be a one-page form that needs to be filled out.
Yeah. Um, that is a lot. I can see why you called it a minefield.
Right, it's when you're not living it, it's easy to be like, well, it's just a simple package that they want you to fill out until
Yeah.
you're actually in it and you're like, wow, this is a lot.
Yeah, it is a lot. I mean, um, it made me think of all the different prescriptions I've tried for the migraines that I have over the 11 years I've had them. Um, and um, or the different um ways I've tried to make my life a little bit easier with NLD. That's the abbreviation for nonverbal learning disability. Um, and like you said, um, you can the, like with the forms or with the prescriptions or the different ways to um, attack a challenge. It, yes, it can help to some extent, but I think until you're living the experience, it's hard to tell what it's like to be in that person's shoes. I mean, you can definitely try to imagine it and try to see it from their um, point of view, but it can be tricky to do that.
Absolutely. And as someone who also suffers with migraines, I totally get it. So I know the feeling of someone telling you, well, you can just take some extra strength Tylenol or,
Uh-huh.
almost, and it's like, that does not work for me. That doesn't
Nope.
work for me. I need all the lights out. Sometimes my migraines are so bad that I can't even have sheets on my body because my skin is
Uh,
hurting, so there's so many different levels to it. And
mhm.
when I say like, until you have experienced it, you can't understand. That is like almost an understatement because I know what it's like to literally have to sit in a dark room for hours until the pain subsides, just
Yeah.
enough for you to be able to function enough to be like, okay, now I'm going to get up, I'm going to try, I'll try
Hmm.
to manage these painkillers. And so like to ease you, like the cool rags on your head is not working, the heating
Hmm.
pad, the ice is not working. When all those things don't work, it's like, so where are you now when all the things that don't work are not working?
Yeah.
And even when you go into the doctor and you're saying like, well, this dose of medication is actually not working, my migraine is still severe, and they're looking
Hmm.
at you as if you're just becoming addicted to painkillers, and now you're pleading and you're begging for something stronger when the pain what they're giving you is not, it's just not, the painkillers they're giving you is just not working.
Yeah.
um, for someone who suffered from chronic body pains because of all my illnesses, I was constantly battling with the doctors, trying
Mm.
to get them to understand that my tolerance for pain medication had built up because I was on so many different medications already.
Hmm.
And what I noticed that I was being dismissed. I was being dismissed as if I was becoming addicted to painkillers, and it's like, it's not that. It's because I'm constantly hunched over that my back
Hmm.
is bothering me because I'm in so much pain, but pain in my chest from the fibrosis. So now it's causing another condition. So now I have pinched nerves all down my spine
Oh
because
boy.
because for 2 years I was walking hunched over because I didn't have the strength in my body to sit upright.
Hmm.
And then the walker they gave me was too low, and they wouldn't give me a higher risen one, unless I purchased it on my own, which is a whole nother thing that it took
Mm.
forever to get, your insurance to cover things that you needed to be covered. And that's a whole thing in its own. But when you have a terminal illness, it's like they give you one medication that snowballs into something else with another issue with your body that snowballs into something else. And as it's
Mhm.
day, I take 23 pills per day.
Oh,
23,
wow.
23 pills per day. And so when I say it's days where I have chronic pain, where I literally cannot get up out of the bed. Um,
Mhm.
there was a lot of resistance and challenges going back and forth with the doctor, getting them to understand that the prescriptions that you're giving doesn't work for me. Don't tell me about what works for other patients or
Yeah.
other, or someone else who had a similar issue to me because they're not me. And that's
Mhm.
another challenge. That's another challenge that individuals face when they have an invisible disability, is everyone wants to tell them about someone that they know is something
Mhm.
similar to what they have, and how this one fruit or this one plant or this one thing they can do could solve all the issues and
Mhm.
the problems that you have. And it's just untrue.
Yeah. Yeah. Um, yeah. Uh, I can relate in many ways with what you said. I mean, um, I actually the glasses I'm wearing are for migraines. I don't know if you've seen them before, but they help filter out some of the light that cause
Hmm.
migraines. Um, and it took me a while to find them because I had tried blue blue light blocking glasses. That's hard to say. Um, and I have prescription glasses, so I had to have like a clip on over my glasses for that. And um, it helped a little bit, but then when I found migraine glasses, um, I was like, okay, well, I don't think insurance will cover them because there's not that much research behind them. Um, and so, and you can't really do it in person, you have to do it online. So long story short, I have two different pairs. I have one that does 50% um, for the light, and then one that does 80%. These are the 80% ones. Um, and I, it does help to some degree where the migraines aren't as severe when I wear them. Um, and thankfully, they weren't that expensive. They were less than $100, which is good. But it, like you were saying, it there's a lot of the minefield is a perfect term because there's a lot of different steps you have to go through for whatever it is, glasses or prescriptions or a form or whatever. Um, like for me, for my full-time job, uh, I'm fortunate because I work actually for my parents. Um, I can carpool with them to work because I have been taking a break from driving for over a year now because I really sometimes I can't drive because of the migraines or because of my visual spatial challenges with my learning difference. So it's it's challenging for me to get around. But we've been doing really well with that over a year now of them taking me to my doctor's appointments when needed, them, taking me to work. Um, and now that I'm living on my own and have been for a few months, it's a little bit more challenging, but it's a good thing I live only 12 minutes away from them and it's not too out of the way for them to help me. And like you were saying earlier, not everybody has that kind of support. I'm very fortunate that I do. Um, and so I can understand it, you know, I can try to understand what it would be like to not have that. Um, but let's see. Another thing I wanted to ask you was what are some common tactics used by companies to delay or deny accommodation requests?
Ooh, that is a good one because there's so many, right? So
Yeah.
there's often, like I said, there's often that the need they have to want multiple letters from your doctors, and
Mhm,
most of the forms they won't take the copy of it. They want the
mm,
actual stamp from. They want to see the actual stamp for the doctor.
okay.
So which means you have to go into office to
Mhm,
get those things. Um, there's often the constant repeat of how often they want the letters. So although your doctor may, for example, with someone who suffers with migraines, let's say your doctor will say, well, she needs to be, Jennifer needs to work from home at
mm,
least 3 days out of the week because she has to cut down on her screen time or
mhm,
the distance and traveling to support her need. And then it will be well, let's have another meeting and let's see if we can get, or they try to get you to compromise and say, well, what
mm,
if what if we get you to come in? What if we get you to instead come in 4 days, but we allow you to leave early on
mm,
the other 4 days? It's like, well, does that really help if I still have to do the traveling? If the traveling, me
mm,
driving in is the issue, or the
right.
traveling, or me taking the train with with the noise, but because of my migraines and the social, the social effectiveness of my me being able to see, like, does that matter? Like, does that really help me? Because I'm
Mhm,
still now having to leave to get these things done. And it's not beneficial. It's not beneficial to your health,
yeah.
you know. So that's another example. And then you have the perception that they want to put of fairness, and which
Mhm,
I always explain to people that fair is not equal. um,
mhm,
fairness is about giving someone what they need based on their needs. It's not about giving it to everyone, because
mhm,
everyone does not have the same issue or the
yeah.
same. So when they bring up this term of, well, it's not fair because we have other people who would like to work from home, it's not that this is what I want. This is what I
Mm,
need. And it's that
mhm,
balance and that recognition of the difference between need versus want when it comes to
yes.
accommodations. When people are asking for accommodations, especially someone who is asking for a reasonable accommodation, not just a general accommodation, because you have the general accommodation for someone who does not necessarily need it for medical reasons, but then you have the reasonable accommodation is reasonable because of a health issue that this person have, or some type of hardship that this person had. And the reasonable accommodation is not a want; it's based on a need. And so those are like three of the top top reoccurring issues that most individuals have, um, when they're navigating these spaces and navigating the workforce, and they're seeking this support. And so that's why, for me, it's so important to train corporations and non-for-profit organizations on what does it look like to lead from compassion, what does it look like to be trauma informed, so that you're not re-triggering
Mm,
someone when they're coming to you and being open and honest and saying, like, this is the help or this is the support that I need to, one, be mentally in a space where I can do and be the most effective, being physically in a space where I can be the safe and most effective, but being emotionally in a space where I can show up and contribute. Because if you are emotionally detached,
yeah.
then more than likely you're not being your most productive.
Mhm,
And from a corporation standpoint, they're focused on productivity. That's
yeah.
their focus. So if you want me to be productive, and I need you to be able to meet my reasonable accommodations so that I can protect myself, protect my health, protect my mental and physical wellness, but also do the job that you hired me to do.
Mm, yeah. Um, well said. Uh, yeah, I mean, there are, like you said, there are many ways they can deny accommodations, or try to deny them.
Mhm.
Um, I mean, uh, trying to think of, I forget exactly who I was interviewing before. I think it was somebody in Canada who was having challenges with um, either Canada or the United States. I think I've interviewed people in both places who have had challenges with academic accommodations being approved by professors or I'm sure it can happen in the workplace too. Um, and when that happens, it's like you said, it's a want. It's not, it's, it's, or it's a need,
It's a need, not a want,
not
right?
want. Yeah. That it's a good thing, good distinction between those because it's true. You need those things. Um, yes, you may also want them, but you definitely need them. Um, and, uh, you know, it's, it is challenging. Like I remember when I was just starting with uh my neurologist with the migraines and trying to find the medications that would work and how exhausted I was from them and coming to my mom or my dad saying, I know I have work to do, but I would have intense migraines. I used to call them sledgehammer migraines when it was really bad. I used to have them 5 to 7 times a week. Um, and now they're 2 to 3 times a week. So a lot of things are better. But before it got better, I used to have to take naps for 2 hours in the middle of the day because I just couldn't. I would find myself falling asleep when I was trying to work, and that's not good. Um, Even more scary than that, when I was driving on my own, I would notice I was falling asleep when I was behind the wheel.
Mm.
And so when I noticed that, I was like, okay, I'll pull over and I'll take a nap and I'll lock myself in my car, you know, and that was happening when I was driving home from work. And so obviously my work was very taxing on me. And that was before I was working for my parents and when I had to drive a lot more to and from work. And so, you know, it's definitely challenging.
Absolutely. And just hearing that, I'm thinking about there's so many different things that could have happened in between, right? Which
Mhm.
doesn't wasn't protecting you, wasn't protecting your safety, but it wasn't protecting others either. Because you driving and your migraine is hurting so bad, so you're not recognizing that you're falling asleep. You could have been
Mhm.
in a car wreck, you know,
Right.
one or something like that, and then and that would travel with you for the rest of your life because you would have been beating yourself up saying, oh my goodness, I can't believe I did this. And not recognizing that it's an illness, not recognizing that you
Yeah.
this wasn't a choice, it wasn't something that happened, this is something that happened based on an illness that you have. And
Yes.
so that's a big thing that people grapple with when they are battling illnesses, is because when you have that need to not want to let go of the things that you can control,
Mhm.
and the old pieces of you that you're so used to wanting to be independent, and
Yeah.
then recognizing that change of I can no longer do this. I'm gonna have to allow someone else help me to
Mhm.
do that. So that it's that self battle, that battle with self, and getting to a point where it's like, all right, Jennifer, you can't do this anymore. This is not healthy for you, Jennifer. You don't want to hurt. And when I'm saying that, I'm thinking about you speaking to yourself and just thinking like something has to happen. Something different has to happen. Something different that hasn't happened. This can't be it for me. And those are conversations that we have with ourselves when we're battling different types of illnesses. Because we have to realize that there's more to it than just work. And you were doing that because you were working for someone else, right? It wasn't like you were working for your family yet. You were working for someone else. So
Mhm.
their needs needed to be met. So you didn't want to let them down. You wanted to make sure you had that safety net, because if I don't work, I don't get paid, then the bills don't get paid. So you had all those things snowballing,
Yes.
snowballing and happening. So that's the reality of many individuals who are living with different types of illnesses, those who even if it's not an illness, someone who's living in a domestic an abusive relationship, or someone just coming out of an abusive relationship,
Mm-hmm.
someone who has experienced some type of community violence. These are all the different things, or that they go through. And although their situations may be different, some of the nuances of the things that they experience, when I say nuances, I mean the battles that they're faced with, when they're just trying to make it day by day by day.
Yeah.
It's very challenging. It's very challenging. And like I said before, if you haven't lived through it, textbook is not enough. And so that's why it's so important for me to give my talks, and so important for me to, push my books, because I
Mm-hmm.
have lived through it. I am living with it.
Yeah.
But I'm also, my background and I have the educational experience to back it up as well, and the research to back it up as well. And so that sets me apart from other behavioral sciences and other authors and speakers, because I'm speaking to you from a place of not only compassion, but relatability. And I want to say understanding, because everybody's situation is different.
Yeah.
I am very compassionate because I've been through some of these challenges, but I can also relate
Mm.
because I've been through some of these challenges. So
Mm-hmm.
my approach is different. My approach from a leadership standpoint, because I've been a leader before, and so I know the things that my like the school chancellors or the school board expected of the leadership team, and the pressures that we had to put on teachers. So I understand from that point, but I also understand it from being an employee. I understand it from being someone who's disabled. So when I put these practices together, saying my model from moving from trauma to triumph, I'm coming from two different spectrums to meet in the middle with a strategy that works for both the employer and the employee.
Yeah. I think I'll just ask a couple more questions. Uh, how do standardized inclusion policies unintentionally exclude employees with disabilities?
And that's a great question, because often people overlook
Mm.
with disabilities because they generalize the policies, they generalize whatever the guidelines are, and they have this cookie cutter policy that they feel everyone should be able to fit into, and it doesn't accommodate or a lot for someone who has disabilities, because my situation is not the same as a regular individual. My situation as someone with pulmonary fibrosis, my situation is not the same with someone with chronic asthma.
Mm-hmm.
My situation is not like I have to have a double lung transplant.
Mm.
So you cannot, you can't, my needs are not the same as someone who says, like, okay, I can't do recess because I have to take an inhaler, or I need a treatment. I can't do recess because I cannot walk for a certain period of time
Mm.
without collapsing. So so my need
More
to do something else is, it's different. I
Yeah.
can't, you know what I'm saying? I can't walk up and down the stairs because it's too much on my body. But that's
Mm.
because, again, I need a double lung transplant. Someone else who is just has maybe they had a knee injury, and they just needed 6 weeks to heal. But now they're no longer, that disability or temporary disability is gone.
Mm-hmm.
That choice for them, you say, you know what, that fear, I don't want to walk up and down the stairs because I'm afraid I'm going to fall. As that's not the same as someone whose body is too frail or too weak who
Mm-hmm.
walks up and down the stairs. So those accommodations are different. And what happens with these policies, the policy is just general. It's usually something to the effect that, oh, if you can, if, like, let's, for example, when I was working in the school, it can be like, oh, you can swap out your lunch duty with someone
Mm.
uh maybe twice a week, but no more than twice a week. That doesn't work for someone who doesn't lunch duty is not something that they can do based on their disability.
Okay.
And that's a little example. But when you think about let's say someone who is like a neurodivergent or someone who has autism,
Mm.
for you to say, well, I need you to do dismissal, and you're working in school and I need you to do dismissal. Everyone knows dismissal is loud, right? It's
Mm.
kids, they're ready to go home. That you got the buses, you got to get the kids to take a bus, you got to get kids to after school programs. The kids are loud, they're transitioning, and they're moving fast. And for someone who has sensory issues, that's not the opportune place to put them in.
Yeah.
So for you to say everyone in the policy, every employee has to do dismissal at least for a month out of the school calendar year, but then that's not something that's sustainable for someone with that type of disability. And
Mm.
so when I say that they forget about those with disability, they forget about the small parts of the reasons why they can't do certain tasks. And they just fit, well, you saw the handout, you saw the employee handbook. These are all the expectations that we have for everyone, and you agreed to it. But there was nothing else for me to sign. So
Mm.
when you give me this employee handbook and you say sign in that you received the employee handbook, I'm signing that I received the employee handbook, but there's never a discussion about what needs to be changed or inserted. And so that's why it's so important for HR, for the HR department to be trained when they're making these handbooks to make sure that they're putting things in place to cover those gaps or to close those gaps.
Yeah. Definitely. Um, Let me see. Let's see. I also want to ask you this one. How does the book illustrate corporate gaslighting in the accommodation process?
Of corporate gaslighting.
Mm.
That ties back to a little bit of what we were talking about when you get to that. Well, we have other employees who need certain, or they're requesting for accommodations, or they're requesting to work from home, but they were able to come in, so you should be able to come in.
Mm.
Or the idea of um I know someone who has migraines, and when she gets migraines, she just takes an extra strength Tylenol, maybe sit in the office for about an hour or so, and then she's okay. So are your migraines really that bad that you need to not come in? Are your migraines really that bad that you need a special computer, or you need a certain type of frame to go over the screening? That gaslighting of it's all in your head. That gaslighting of I know someone else who had a similar situation in yours, and they're not asking for it. They don't need the things that you're requesting or the things that you need. So
Yeah.
it's almost to make you feel as if by you requesting these reasonable accommodations, you're doing too much or you're asking for too much.
Mm.
Um, to get you to kind of like back off or back down
Mm.
and just agree to whatever it is that they're willing to give you. And so that's what the corporate gaslighting becomes. But it becomes of this, is this all in your head? Because I prefer for you to be here. And that's the language that they kind of use. It's like a nice nasty, I like to call it, where they're smiling and they're like nodding and like, oh, I feel so bad that you're experiencing this. What do you think about? And then they meet you. They come with the nice. What do you think about? And they switch around what you need, what your
Yeah.
request, what your needs are to meet their needs.
Mm.
They're still prioritizing themselves, or making it seem like you're doing whatever by you needing this assistance, you're creating the hardship on them, and not
Mm.
and not looking at it as they're creating a hardship on you by not allowing you to be able to work to your best capabilities from the accommodations that you need.
Yeah. I definitely agree with that. They can like you said, they can minimize
Mm-hmm.
what you have, whether it's a migraine or a learning difference or a physical disability, or a mental one.